nursing homes have grabbed most of the attention. The pandemic has also been devastating for assisted living. In Minnesota, they are largely unregulated. Here's Tom Lydon of the Fox 9 investigators.
He was a lumberjack, a barber. He could sharpen anything, he could fix anything, had a great sense of humor, and just had a passion for life.
Jack Bogenreef was wise enough to know what made him truly happy in life. And lucky for him, that included his daughter-in-law, Carrie.
I love you, Jack.
I love you too.
Okay, have a good day.
Okay.
The 86-year-old Navy veteran lived in an assisted living facility, the Encore, at Hugo. When COVID hit in March, Carrie's daily visits ended, breaking both their hearts.
He looked at me and said, "You're staying away on purpose." And I said, "No, I'm not." But I was, because I couldn't go in because of COVID.
From their occasional window visits, Carrie could tell Jack's health was quickly declining. His care seemed non-existent.
I could see dirty on the walls. I could see his nails needed to be trimmed. I could see that his beard needed to be trimmed, that his oral care wasn't being done.
State investigators would confirm her fears in September, uncovering negligence at Encore. A resident who fell twice, another who lost 20 pounds in a month and hadn't been bathed for 3 weeks. An infection control survey discovered employees weren't being screened. 5 employees got COVID, along with 16 residents. 9 residents have died. Encore did not respond to calls from the Fox 9 investigators. After 3 months of lockdown, Jack went to the hospital for a urinary tract infection, which had developed into sepsis. He came back to Encore, only to die from COVID 5 days later.
You left me after I left you to go for a walk. I held your hand all morning, and I will forever miss your big mitt hugging mine.
Jack's story is part of a hidden pandemic. 17% of all those who have died from COVID in Minnesota have been in assisted living. That's 829 lives lost. Only skilled nursing facilities have had more deaths. But unlike nursing homes, assisted living facilities are not licensed by the federal government. In fact, Minnesota is the last remaining state to license or regulate assisted living. Currently, the state only licenses service providers, those who come in to help residents with specialized care, like bathing or housekeeping. Last year, the legislature passed sweeping changes to license assisted living facilities, but the new rules aren't scheduled to go into effect until next summer and might even be delayed until 2022. And for that, we may be paying a terrible price.
By and large, the assisted living sector is flying under the radar without a black box. There's extreme lack of transparency.
U of M professor and gerontologist Alon Caspi believes the lack of staffing and regulations, on top of a pandemic, made for a worst-case scenario.
COVID exposed many of the systemic failures in assisted living residences across Minnesota. It exacerbated those conditions. It increased the risks for the vulnerable and frail population.
To understand why, you need to know the differences between a skilled nursing home, which provides 24/7 medical care, and assisted living. Assisted living residents have their own apartments, allowing them to live more independently. And for many, it doesn't carry the same stigma as a nursing home. There may be a licensed nurse on staff, but residents rely mostly on care attendants, who may have little to no medical training except for what they've received from their employers. And it's not cheap. The average cost for assisted living in Minnesota is nearly $4,000 a month.
I would agree. Some would say the assisted living is the new nursing home.
Susie Scheller is an attorney specializing in elder abuse. She says while some seniors are healthy and independent enough for assisted living, many others have needs that are just too great or deteriorate too quickly. 40% of those in assisted living have some form of dementia, and more than 1/3 of the assisted living facilities in Minnesota have a memory care unit.
And so really what we're seeing is a high level of needs and care in the assisted living where the consumer choice model doesn't keep pace with it, in our opinion. And we need to have more input, more regulation, more look at what is happening within the buildings.
The Minnesota Health Department believes the biggest issue for assisted living is staffing. The industry can't even fill the positions that are open now. According to an industry trade group, there were more than 7,000 unfilled caregiver positions at Minnesota's nearly 2,000 assisted living facilities. Part of the problem, experts say, may be a starting wage of $15 an hour.
Behind closed doors, people just don't see what's happening to their loved ones. It's heartbreaking.
Susan Throndrud saw how bad it was before the pandemic, courtesy of a camera she installed in her 90-year-old mother's room at the memory care unit at York Gardens in Edina.
Help me!
One night, her mother woke up and started calling for help. After 40 minutes, she slid off the bed, but an alarm on the bed failed to go off.
Help me!
She spent the next hour lying on the floor, crying out for help.
Please help me, Lord.
There were 3 other falls in just 2 months. In each case, the bed alarm failed. The family was paying nearly $7,000 a month for her care. And when an attendant insisted that they'd spent 47 minutes with her mother, she checked the video.
And 31 of those minutes she was on her cell phone, yelling across the room to my mother to get up. Something's fundamentally wrong with the system that allows an elderly woman, anybody elderly, to be disregarded.
After Throndrud's mother fell, Ebenezer, which owns York Gardens, said they took immediate action, including more frequent resident checks, making technological adjustments to ensure our sensors and equipment function properly, and additional staff training. Throndrud took her mother's case to state lawmakers, who last year passed those sweeping changes in elder care protections, licensing all assisted living facilities, biannual inspections, separate licensing for dementia units, and specialized training for staff. State Senator Karin Housley says the legislation was long overdue.
I take probably 2 to 3 phone calls or emails or texts or Facebook messages a day from people with concerns about their loved one in a long-term care facility.
But there just doesn't seem to be a sense of urgency.
And time is not on anyone's side, certainly not during a pandemic that still rages through Minnesota's assisted living facilities, leaving families to wait and wonder what kind of care their loved one is receiving, and if anyone is truly watching. For the Fox 9 investigators, I'm Tom Lydon.